discussed yesterday during Technology Day, instead of going through chapters 1 through 11 of Module 1, we will have 4 PowerPoints that will summarize that content. These PowerPoints will be based out of Davis's drug guide, and it's okay if you do not have it. The material can still be found in your pharmacology book throughout those 11 chapters, and I will also make sure to provide a copy of the PowerPoints in class on Tuesday. They're also available in Blackboard without the voiceovers for those who may have access to a printer and may need to print them and jot down notes as you go through these voiceovers, but I'll also leave these up so you'll always have access to them. So we're going to start out with medication errors, and one more thing, we will go over, today I'll go over the 2 PowerPoints that we would have covered during class, and then next Tuesday when we return to pharmacology, we'll pick up with the remaining 2 PowerPoints and the rest of the content that we would have covered during class today. So we'll start out with medication errors, and this will be coming from pages 12 through 17 of the 16th edition. Again, if you have an older or newer version, it may differ. The page numbers may differ. So we'll start out talking about drugs, what a drug is. A drug can be any small molecule that changes a body function by working at the chemical and cell levels. Drug therapy is when a plan to improve a problem includes drugs. So think about when a patient is diagnosed with an illness, a disorder, or a disease, or whatever it may be. The physician usually will initiate drug therapy to treat or resolve symptoms that the patient may be experiencing. Drugs can include everyday substances such as caffeine, alcohol, nicotine, things such as vitamin C. Some drugs are manufactured from chemicals, others may be taken from plants, and some are taken from a person or animal to be used by another person. You'll hear the term medication and drugs used interchangeably. Some use the term medication to describe substances that are used to treat health problems, and some may use the term drug to describe substances that are harmful or can be used. So again, why do we give drugs? Drugs can be given to prevent, correct, or reduce health problems, and they're also used to treat and diagnose health problems. As a nurse, to accurately administer medications, you need to know knowledge related to the legal aspects of healthcare, pharmacology, pharmacokinetics, life sciences, pathophysiology, human anatomy, and your mathematics, hence your drug calc. So when you leave this course, you will not know every medication that is out there to be given. But as a nurse or as a nursing student, your job is to make sure you look up every medication that you administer, well, before you administer it to your patient. If you do not know, there's nothing wrong with looking it up. Throughout my 9 years of med-surg nursing, I still do not know every medication that's out there. But I make it my responsibility to know what I'm giving my patient before I give it. So you need to understand the action and effects of all medications taken by your patients before you give them. Factors of drug therapy include identifying the specific health problem, determining what drug or drugs would best help the problem, deciding the best delivery method and schedule. Some drugs are best, they work better given at a certain time or a different route. Ensuring that the proper amount of the drug is given, and helping the patient become an active participant. So when we talk about med errors, approximately 98,000 people die in any given year from med errors that occur in hospitals. These errors cost hospitals more than $3.5 to $4 billion annually. Nurses play an important role in patient safety, especially in medication administration. As a nurse, you have a huge role during medication administration because you're the last person that has that medication before the patient gets it. So it's your responsibility to check the medication, make sure it's the correct dose, the correct route, whatever, before you give it. You want to make sure that everything is correct. Nurses should know how to calculate medication doses accurately and must understand the different roles of each healthcare team member prescribing and administering medications. That includes the NPPA physician, the pharmacist tech, whoever may be a part of the team. So to administer medication safely, you need to understand basic mathematics skills to calculate medication doses, which will be, again, your drug calculations, mix solutions, and perform a variety of other activities. We briefly discussed a few things related to medication errors, but what is a medication error? A medication error is a preventable event that leads to inappropriate medication use or patient harm. A medication error may be caused by the prescriber, the student nurse, professional nurse, pharmacist, or even the patient. Again, you want to keep in mind who administers these medications. As the nurse, it is your job, your responsibility to double check medications before you administer them to your patient. Always double check these medicines, because when a medication error does occur, the first person they'll look at most likely is the nurse, because a lot of medication errors happen during administration. Causes of medication errors. Medication errors are not always the result of poor quality staffing. Error-prone processes involved in medication use systems do contribute to medication errors, and excellent experienced practitioners do make mistakes. So let's talk a little bit about staff. Who do you think of when we say staff? Think about your team, as we discussed in the previous slide. Who is a part of the team when it comes to medication administration? Think about physicians, pharmacists, pharmacy tech, nurses, anybody that is a part of the team when it comes to medications. So what are some of the different roles in drug therapy? The prescriber's role would be to prescribe the drugs and order specific drugs. The pharmacist's role is to mix and dispense prescribed drugs. The pharmacy tech's role is to mix and dispense prescribed drugs under the direction of the registered pharmacist. The nurse's role, which will be your role, is to administer these medications directly to the patient. Also, to determine medications are ordered correctly, again, double checking those orders. Assessing your patient's ability to self-administer, and this comes in with education, patient teaching. Determining whether a patient should receive medication at a given time. Again, this comes back to your assessment of your patient, determining whether the patient needs it, whether your patient can tolerate it, or whatever the case may be. Administering your medications correctly. Again, this double check process that you need to do before you administer your medications. And then closely monitoring the effects of the medicine you're administering to your patient. The nurse's role cannot be delegated. Again, the role of the nurse during medication administration is crucial. I don't know how many times I've said that. That is important for you to remember. Patient and family education about proper medication administration and monitoring is also a part of the nurse's role. So, most medication errors do not result in patient harm, but some medication errors do result in catastrophic harm or death. Let's talk a little bit about high risk with high alert drugs. These are highly toxic drugs, or drugs that have a narrow therapeutic range, which have a high risk for toxicity and causing devastating injury or death. In Davis Drug Guide, again, I have the 16th edition, but on page 16, Table 1 does have a list of high alert drugs. There are several high alert medications, but insulin is one that is very common. In some facilities, high alert drugs do have to be verified by 2 nurses before being administered. They need that extra safeguard because they can cause devastating injury or death. I know in the facility that I used to work for, insulin would have to be verified by 2 nurses. So whichever nurse did go and pull the medication up, a second nurse had to sign off on that medication to verify it was the right med, the right dose, the right patient, before it was administered. So a lot of times high alert drugs will have that extra safeguard. So we are going to go in a little bit of detail about causes of medication errors. Let's first discuss some of the elements of the medication use system. Keep in mind that these elements do play some type of role in medication administration, but also remember that errors can occur in any of these elements. So these elements include communication. So think about if you have poor communication, error can occur. Labeling, packaging, and naming. If there's any issues with any of these on when it comes to medications, error can occur. Administering medications, we know that error can occur. When it comes to monitoring drug levels and therapeutic or non-therapeutic responses, and this comes in when you have like your antibiotic dose and your vancomycin, medications that require drug levels. If something goes wrong, then error can occur. And thorough patient education. If we do not educate our patients, they go home, they misuse their medication, error can occur. First element was communication. So keep in mind, anytime you have communication problems, something can go wrong, and it's the same with medications. Communication problems include things such as similar sounding or similar looking names. You will have medications that look like the same name, but there may just be a slight difference. You have to pay attention to these types of meds. Using package units such as one tablet instead of a specific milligram dosage. Write ambiguous or incomplete orders, or using abbreviation or unnecessary zeros in an order. Again, if you do not understand an order or just are unsure about it, you always want to clarify. Make sure you have the correct order. Orders can be written by hand or electronic, verbal, or given over the telephone. If you get a verbal or telephone order, you must read that order back and verify to confirm accuracy. Nursing students cannot take medication orders of any kind. Some hospitals also utilize computerized order entry to try and decrease medication errors. I can tell you that a lot of physicians do not like to follow this and like to take the easy route, throw out an order to you, but it's your job to make sure that it is correct. You only want to use abbreviations with caution and only use approved abbreviations. Misuse of zeros. You always want to lead with zeros, but you do not want to trail with zeros. This could result in underdosing or overdosing your patient. So if you fail to use a leading zero, or if a physician fails to use a leading zero, then it may cause overdosing. For example, writing zero point 0.2 micrograms instead of 0.2 micrograms may be misinterpreted as 2 micrograms. So you always want to lead with that zero. Or using an unnecessary trailing zero, for example, 1.0 micrograms or milligrams instead of 1 milligram may be misinterpreted as 10 milligrams. So that could cause overdosing your patient. Misuse of zeros, again, could lead to underdosing or overdosing. When it comes to abbreviations, you always want to use approved abbreviations. There are error-prone abbreviations out there, and it could cause med errors. Abbreviations can be misinterpreted. For example, if you use MS, does that mean morphine sulfate or magnesium sulfate? When it comes to units, when it comes to medications that do end in units, you always want to make sure you write the word out instead of just writing a U, simply because that U could be mistaken for something else. For example, 10U, hand or computer enter. If you just glance at it or if someone does not take a good look at it, it can look like 100. So you always want to write out the word units instead of just using a U. There is a table in Davis Drug Guide of error-prone abbreviations and safer alternatives. So you always, again, want to only use approved abbreviations to prevent or decrease errors. As a nurse, you will have some sloppily, poorly written orders. Physicians sometimes write orders fast, and they have been a source of medication errors. Orders viewed on a computer screen or printed out can also be misread, and some orders do lack important elements. If you have to ask yourself what the order means or what it says, or if you have to go around and ask a nurse, could you understand this? What does this say? You always want to make sure you ask the original prescriber too. Again, always clarify your orders with the provider if you need to. Doesn't matter how much you may think you're aggravating or worrying them, you always want to make sure your orders are correct. Clarify them if needed. Again, always make sure you have all elements. Nothing should be lacking. You should have every element of the order that you need. Quickly, I just want to touch on the different types of medications orders that may be written. Sometimes you'll have standing or routine orders. Those orders will be carried out until it's changed or canceled. PRN orders will be as needed, and that is important. You'll see that again. Single orders are one-time doses. Stat orders need to be given immediately, and now orders are needed quickly but not necessarily stat. Sound-alike, look-alike drugs could also be misinterpreted and cause medication errors. Some drugs sound confusingly similar or look very similar when printed or written. Examples include Celebrex, which is an anti-inflammatory, Celexa, which is an antidepressant, and Cerebix, which is an anticonvulsant. If you look, you can see how close these medications look. They look very similar, so you always want to make sure you understand which medication you have ordered and also recognize those that are sound alike, look alikes. Labeling and packaging could also contribute to medication errors. Packaging of drug products can look similar. The wrong product could be picked up inadvertently. Tall man lettering is something that is used to help prevent such confusion by highlighting certain syllables for especially problematic drug repairs. If you look in the table that I have, a little chart that I have on the slide, this is what tall man lettering will look like. This type of lettering is included on labeling and packaging so you can recognize what medication it is to prevent errors. Dosage calculation errors are a major cause of medication errors. These can be a mathematical error or a failure to consider the patient's age, renal or hepatic function, or any other modifying factors. This can also include the miscalculation of the dose or rate of administration, as well as misprogramming the infusion pumps. Dosage calculation errors are pretty much anything that can interfere with the dose the patient is supposed to receive. 6 rights of medication administration are important. You always want to use these 6 rights whenever you administer medication. I don't care how many times you administer the same medication to the same patient, you always want to use these 6 rights every time you administer meds. These include the right patient, the right medication, the right dose, the right route, the right time, and right documentation. Most medication errors occur in the hospital setting during administration. That's why it's important for the nurse to always follow these 6 rights. The nurse is ultimately responsible for improper administration of drugs, and that's because you are administering these medications. You always want to compare the order to the prescriber's orders along with the MAR. And you always use 2 patient identifiers when administering medications. I just make it a habit. Hey, Mr. Doe, what's your name and date of birth? I always make that my habit before I administer medications. You want to keep in mind that room number is not an acceptable patient identifier. You cannot use that as an identifier when giving medications. You always want to consult with the prescriber if an order does not designate a route or if the specified route is not recommended. As a nurse, if you know that this patient has trouble swallowing or this patient may be aspirating, you have the right to ask for a different route. Patient attention, you always want to pay attention to medications ordered at certain times of the day and how altering the schedule may affect the patient. I know that in a lot of facilities you do have a grace period, but you always want to make sure that you are using your time wisely. Time management is important because you want to prevent altering the patient's medication schedule if you can. A medication order is required for every medication that you administer. It does not matter what it is, Tylenol, Motrin, you have to have an order. You also want to never document that you have given a medication until you have given it. Keep in mind that a patient also has rights during medication administration. The most important right that I always remember is a patient does have the right to refuse. If a patient says that they do not want it, they do not have to take it. Do not get offensive. You go with what that patient says because that is their right. Some other rights that the patient does have is to be informed of the name, purpose, action, and potential undesired effects of a medication. That simply goes back to our patient education, making sure the patient knows what they're taking, educate them about the med. That's something that you can easily get by. Give that patient that education, and that covers that right. The patient does have the right to refuse any unnecessary medications. Um, a patient also has the right to be informed if medications are a part of a research study. A patient also has the right to have qualified nurses or physicians assess their medication history. Again, the most important right to remember. I mean, you want to remember all of them, but you want to keep in mind that if a patient refuses the medication, that is their right. Remember earlier when we said that poor staffing is not the only cause of medication errors? You also have human and environmental factors that influence errors. These include things such as distraction, culture or perfection, fear of questioning physicians to get those orders clarified, and punitive response to error, which pretty much is shame and blame. Prevention strategies for nurses during medication administration. You want to always make sure you clarify any order that is not obviously and clearly legible. Again, we've said that several times. So you know that's important. You never want to accept any orders with the abbreviation U or IU for units. You always want to make sure that is written out. You want to make sure you clarify abbreviated drug names or dosing frequencies. If a dose requires more than 3 or less than half of a capsule, tablet, ampule, or however it may come, you always want to make sure you check the original order and recalculate the dose. You always want to make sure you confirm any unusual doses with the provider, and you want to make sure you clarify any order that does not have or include metric weight. This is things like milligrams, micrograms, grams. You want to make sure you always have a dosing frequency and a route of administration. And you want to make sure you know why you are giving that medication. During med pass, you want to make sure you are disciplined. You want to make sure you're taking your time. You want to hold yourself responsible and accountable. You want to always make sure you ensure nursing practices, safe nursing practices. As a nurse, you never, even as patients, you want to make sure you educate them as well. Never borrow medications from other patients. Always make sure you are checking the patient's name band and barcode before you administer medications. And also, just because you verbally address a patient by their name, that does not provide sufficient identification. You always want to make sure you get those 2 patient identifiers before you administer medications. Make sure you always check your patient's allergies. Consider food and drug interactions and make sure you're educating your patients. Fully understand any drug administration device before you use it. And you want to make sure you have a second provider check original orders, dosage calculations, and infusion pump settings for those high alert drugs. Medication errors do not only happen in the hospital setting, they also can happen at home. This is why patient education is very important and it should be done before the patient starts to take the medication. You want to make sure you include things such as generic and brand name of the drug, why they're taking the drug. You want to make sure you include the dose and how they need to administer the medication. Educate them on minor and serious side effects and what to do if these side effects occur. You want to make sure you educate them on the importance of follow-up care as well. If a medication error does occur, you always report it, no matter if it does not cause harm to the patient. It could have been the wrong route, the wrong dose, the wrong patient. You always report it, and most of the time you will have to complete an incident report. Making an error does not make you a bad nurse. The best practitioners, pharmacists, physicians, and nurses make mistakes. Just remember that we are human. Make it your priority to try to prevent or decrease med errors, but if they do occur, the most important step is to report it.